Hello, this is the Biomedical Engineering Senior Design Team 11. We are sponsored by the Michigan Tech Biomedical Engineering Department. Our team was tasked with creating an optically based probe for measuring tissue oxygenation and blood perfusion simultaneously in real time. There is a need for a non-invasive way to gather information about blood supply to certain parts of the body before, during, or after surgical procedures. In particular, one common test is known as the Allen's test. It is used to check blood flow to the hand from the ulnar artery to ensure sufficient blood supply during procedures involving intravascular access through the radial artery. It is performed by squeezing blood out of the hand and occluding the radial and ulnar arteries. The ulnar artery is then released, and the hand is visually inspected for the return of color, indicating blood supply through the ulnar artery. This method is crude and relies on visual inspection rather than quantitative data. Our team has developed a probe that performs oxygenation measurements and perfusion imaging to provide an in-depth and quantitative look at blood flow in the hand. Our final design for the probe uses two techniques, pulse oximetry and laser speckle contrast imaging. Pulse oximetry is performed using a commercial oximeter chip, and contrast imaging is performed using an 850 nanometer laser diode and a small camera. The oximeter chip and laser diode are regulated using an Arduino Uno. The camera is controlled through its included camera board. The assembled device houses the two boards in an instrumentation box, while the probe, containing the oximeter chip, laser diode, and camera, is wired off. The two boards are connected to a computer via USB, where the output is displayed in a graphical user interface in MATLAB. MATLAB code also regulates the probe components so that the oximeter and diode turn on and off at different times. To test our probe, we first restricted blood flow to the hand by wrapping an exercise band around the wrist. The probe was then placed on the palm, and the program was started. The program was allowed to complete a few measurement cycles before finishing. The output from the probe shows a contrast image and an SpO2 measurement. The contrast image gives an indication of blood flow. Blood flow causes the speckle image to become averaged out over an exposure time, decreasing contrast. A lack of flow will produce an image with higher contrast, shown in the color yellow in the image. We then restored blood flow to the hand by removing the exercise band. The probe was again used for a few measurement cycles. The output from the probe shows a noticeable change in both SpO2 and the contrast image. The SpO2 value has increased to 95%, which is within normal range. The image shows less of the color yellow, meaning the global contrast is lower, and therefore blood flow in the hand has increased. The tests performed using our probe show an increase in SpO2 and a decrease in mean contrast after restoring circulation to the hand. These results indicate that using laser speckle contrast imaging and pulse oximetry simultaneously is a feasible method for gathering quantitative information about blood flow. If a team were to continue this project in the future, we'd recommend performing tests on a tissue phantom and designing a way to secure the probe on the patient's hand. Also, we suggest optimizing the pulse oximetry system, as measurements are widely variable across different locations on the hand and are therefore not always accurate. Thank you on behalf of the Biomedical Engineering Senior Design Team 11 for watching this video.